GNAPHALIUM is more or less a neurological remedy. It ranks among the top remedies for neuralgic pain. It has a special affinity on the sciatic nerve. But the characteristic pain of GNAPHALIUM is very important. GNAPHALIUM pain always alternate with numbness. This is the main genius of GNAPHALIUM. Its most close analog remedy is colocynth, where colocynth also have a special affinity on sciatic nerve. But the difference is colocynth pain do not have any such character like pain alternating with numbness. And the pain of colocynth is better by warmth and pressure. And also colocynth pain has an aggravation around 4 pm like lycopodium and helleborus, where GNAPHALIUM has no such thing. But the exception is only the headache of GNAPHALIUM. In some patient it has been noticed that the headache of GNAPHALIUM is aggravated around 3 to 4 pm and it is better by cold bathing and cold application. The characteristic backache of GNAPHALIUM is also very important. The backache is in case of GNAPHALIUM, the backache is always better by sitting on a chair and drawing up the limbs towards the abdomen like this. This is the characteristic of GNAPHALIUM backache. Whereas in case of the backache of conium feels better by sitting on a chair and drawing or resting the limbs in a chair. This is the differentiating point between GNAPHALIUM backache and the conium backache. GNAPHALIUM is also used for dysmenorrhea. The characteristic is at the beginning of menses, there is a sense of weight and fullness around the pelvis. A sense of weight and fullness around the pelvis. Whereas in xanthocylum, there is extreme neuralgic pain. That differentiate GNAPHALIUM and xanthocylum. Also, GNAPHALIUM, in Blackwood it is written that GNAPHALIUM is a very good remedy for prospalgia or trigeminal neuralgia, because in Blackwood it is written that in physiological doses GNAPHALIUM has a special action on the maxillary branch of the trigeminal nerve. Only the maxillary branch of the trigeminal nerve is mentioned. Whereas in case of spigelia, which is more or less a specific kind of therapeutic for trigeminal neuralgia, because spigelia it has a special affinity on the whole trigeminal nerve. But in case of GNAPHALIUM, it has special action on the maxillary branch of the trigeminal nerve. This is the differentiating point in case of trigeminal or prospalgia of spigelia and GNAPHALIUM. This is more or less about GNAPHALIUM. I hope you enjoyed it. Thank you.